So before you begin your trach care, you will need to determine what type of trach your patient has. You can do this by looking at the flange of the trach, and there should be some letters and numbers that coincide with the box that trach came in. If your trach ends in an H, you have a disposable inner cannula. If you have a trach that ends in an R, you have a reusable inner cannula. But there are some trachs that don't have inner cannulas at all. So some of the other supplies you will need is your choice of sterile water or normal saline. Hydrogen peroxide is not recommended for routine trach care. Our new Trach Care kit. And within this kit, you have a pack of sterile gloves, a sterile drape, twill tape, which is number 4, and we will actually dispose of that. Those are trach ties. 5 cotton tip applicators, the actual split gauze dressing, and 2 sterile gauze. For those trachs ending in an H, you have a disposable inner cannula, so you will need to make sure you have the appropriate size replacement inner cannula. For those ending in an R, you have a reusable inner cannula, and you will need to clean with these trach brushes. Typically, we will suction our patients if needed before providing trach care. We have a variety of ways to do so. This kit actually comes with sterile water and can serve as a second sterile basin. We would need to make sure we hyperoxygenate our patient for 30 seconds before providing this suction care. These dressings can be used instead of the split gauze that comes in the Trach Care kit in case of pressure. Next, we'll need our Velcro trach ties, instructions on the back, a mask with a face shield, and an ambu bag in case of emergencies. So actually performing trach care, we'd gather the materials that we needed based on what our patient's trach was. We'd want to be telling our patient exactly what we're going to do and why. Maybe even provide them a mirror, that way that they can see what we're doing and being able to educate them along the way so they can do this care at home. Apply our hand hygiene and put on our clean gloves. I would be wearing my mask with a face shield. We'd want to anchor this trach at the flange and gently remove this sturdy dressing, all while inspecting the site, looking for pressure, which generally is under this area of the trach, or any redness or discharge, or if the sutures are still in. Really, before removing this dressing, we may want to apply suction to our patient using our preferred method of choice. So I would still have my clean gloves on. I would hyperoxygenate the patient and then suction using only this depth of catheter. And that's about equal of the size of their inner cannula length. Next, I want to start getting things together to prep my sterile field. Trach care is aseptic, but we try to be as sterile as possible. I'm going to set these gloves to the side. This drape is placed shiny side up so I can touch it with my clean hands, and then that shiny side is going to go down. All the contents of my kit are going to go onto my sterile field, and then now this empty kit becomes the basin for where my inner cannula will be cleaned in. I'm going to open up an extra set of 4x4 gauze. I like to have these just in case, and I'll pre-moisten them so that I can clean if the trach is extra dirty. I'm going to open up my trach brushes and set those in my basin to clean my inner cannula. I'm going to take my sterile water and pour that into my basin and onto my gauze. Then I'm going to apply my sterile gloves. Going to take these extra cotton tip applicators that I'm going to use for cleaning and put those into my pre-moistened gauze. This is the twill tape. We don't need that. We're going to throw that in the trash. These are the dry 4x4s, which I will use to dry my trach after I've cleaned. And then my split gauze. So I'm going to take my non-dominant hand, anchor that flange, and then remove that inner cannula and place it into my basin. Reusable inner cannula trachs do have a backup, but we're just going to clean and reuse this one. So I'm going to clean the inside with my trach brush. And now I'm going to clean the outside. We want to run some sterile water through that just to rinse it. Then we'll kind of tap dry to let some of those water particles come out. We don't want a whole bunch left in. And then we want to reinsert, all still while anchoring that flange. So we're going to take these gloves off. And now we're going to do the actual site care. So hand hygiene, clean gloves, because this is basically just like wound care at this point. Nothing's going actually inside the trach. Anything going inside the trach needs to be sterile, but we're outside of it. So I'm going to use these cotton tip applicators. Going to make sure they're pre-moistened. Kind of wring out the excess if necessary. I'm going to clean around that flange. So you can do this on both sides of the trach. So we're going to take this pre-moistened gauze with one of our cotton tip applicators while anchoring the trach. Kind of get up underneath that dressing or underneath those trach ties. You can do that on the other side as well. So now we're going to use these cotton tip applicators to really get close to the stoma site. I'm going to go in a clockwise fashion underneath that flange. Getting real close there. We want to make sure we rinse anything off that was dislodged while we were cleaning with those cotton tip applicators. And then we want to make sure that we dry the site thoroughly. We don't want it to be wet. And then we're ready for our trach dressing. So making sure that we're still securing at that flange so there's no chance of dislodgement. Slipping that dressing on underneath. So now it's time to change our trach ties. This really just needs to be done once a day or more if necessary. Instructions are on the back. It is recommended to use a 2-person technique to avoid dislodgement. If you are going to do this yourself, just make sure you continue to have a hand on the flange. So that's really it, you guys. Hope this has been helpful. Good luck with your trach care.